Okay. I speak pretty loudly anyways. If the mic goes out, I can handle that. Okay, so, I work for the Food and Drug Administration. I work with Division of Transplant and Ophthalmology Products. Throughout my presentation, and those of my last two colleagues, we're trying to stress, especially in particular, what a project manager is looking for when we're receiving these applications in the office. So I'm hoping to give you a little peek behind the curtain. And that's a reference I feel kind of almost references like the Wizard of Oz, because I feel like when we get inquiries from you, both through email, but in particular over the phone, I feel like sometimes you feel like it's a mystery of what's going on over there. There's a great deal of reverence that you have, which we appreciate, but we want to be your ally when it comes to these applications. And I can see you shaking your head, right? Like you want us to be your ally, right? So we just want to let you know that we come in peace. We also want, we would like your drug to be approved as long as it's safe and, everything after we review it. And just to know that we want to make sure that the lines of communication are open. If you have a question, do not be afraid to call us up or email us and ask it as it pertains to the application. And also, if we have a question, do not hesitate to ask us a question back if you don't understand what we're asking for. So I just want to keep stressing that throughout this presentation, that we need you to feel like you can, advocate for your application to us openly, and we'll speak to you as openly as we're able. So we're going over the NDA and BLA application review process. The learning objectives of this presentation are to develop an understanding of the review process and the timeline for an application, discussing the end of review actions and their implications, and to hopefully give you some best practices to make your application as complete as possible. And before we really get into the nitty-gritty, and this is not a hard question even after lunch, I'm going to ask you all, how many people in this room and even online would like to have their application approved during the first review cycle? Okay, easy enough, easy enough. I don't see your hand. I don't see your hand. Okay, so everyone should have had their hand up. No one wants to go through a second and a third review cycle. I mean, it happens. We know, like Callie stated, your blood pressure goes up. We hear you, and sometimes even our blood pressure goes up because, by the time we're getting a second and third review cycle, we know you by this point. We hear you on the phone. We've talked about our kids. We know our families. Really, we want to get you there, okay? So we just want to make sure that, we're paying attention today. Some of this information will be repetitive, but where I can, I'm going to try to just tell you what maybe our thought process is in some of our respective internal meetings that we're having about your application. Okay, so the initiating process. So that begins with the receipt of the application. The application comes in electronically to the FDA and then is triaged to what we call a chief project management staff. And that person is usually the person that me, the project manager, directly reports to. And then she makes sure that this goes to the respective project manager that she's assigned whoever's application to, so that we can get reviewer assignments. So then it's sent to me, and then as a project manager, we're looking for like glaring omissions before we actually acknowledge your application within that first 14 days. So this is not an all-inclusive list. I just put a couple of things on here, but some things that we're looking for that are easily found are the user fee. If you've been talking to us, at the pre-submission phase, then we're going to know kind of exactly when you're paying that user fee, because you'll let us know. You'll give us a heads up. You'll say, hey, just so you know, we're about to apply for this. We're sending in our user fee. And there's a guidance there for that, about user fee, the waivers, any reductions, anything like that. There's a good guidance that I provided for you there. And then the structured product labeling, we're looking for that to be in your complete application before we submit that acknowledgement letter. And the Form 3674 that Swati talked about in her presentation regarding the clinical trial certification. But again, this is not an all-inclusive list. These are some glaring things, but there are also some other glaring things that we look into. But I didn't want to put it all on there because I only have so much space to work with. So yeah. So our responsibilities as the project manager, once we actually, lay eyes on your NDA or BLA submission, the time clock begins when the application is received in the FDA, not when it's on our desk. Because there can sometimes be, a day or two between the time we get it from our CPMS, potentially. And the receipt date is calculated off the actual date it was received and not the letter date. It used to be that when we received these applications, some of them could, be received through paper. Everybody remembers paper, right? It's this stuff. uh, so it could be received through paper, and so there would be, you're sending it through the U.S. Postal Service, and so you might have one date on your 356H, and then it comes into our actual office in another date. Now everything is submitted electronically in terms of the NDAs and the BLAs, and so usually those dates align. However, if they do not, because maybe you submit it electronically, maybe towards the end of the day, even the computers get days off. So, there might be a slight difference, but we're still taking the actual date that, it was received electronically. And then we're making sure that you get that acknowledgement letter in writing by day 14. Now, you can also, again, if you know us, if you've had your pre-submission meetings, you kind of think it's going to be assigned to us, which is not always the case. That's another little peek behind the curtain. Just because we handled your application at the pre-submission phase does not mean that we will get it when it comes in, as an NDA or BLA. It's just depending on how much we already have on our desk. However, again, if you made us your allies, we might say, oh, well, I do have a full desk, but I know exactly, everything's going on with this. So we might take on, they'll give us first dibs on it in the office. They'll say, hey, we know you got a full plate, but do you want to take this? Are you able to take this? And we may or may not, depends. So we're acknowledging receipt of the day 14 application. And my point was, if you think that it may come to us, even if it doesn't, if you have your NDA number, even if you don't, because we can search by drug name, you can call us up and just ask us, hey, did you receive it? Have you seen this? And we can at least, just tell you that it's here. But, we may not be able to say that we're actually the project manager at the time. So we're also just ensuring conformance to the regulatory requirements. And this is when it comes across our desk. We're making sure that our internal tracking systems have tracked your submission as a new drug application. Obviously, this is very important. We don't want it to be coded internally as a meeting request because especially, obviously, if it comes in as a new drug application, it starts to generate timelines. And obviously, this is different than a meeting request. So we want to make sure internally that it is, tracked appropriately in our respective systems called DARTS and Panorama. We're also making sure that it is administratively complete and compliant during this early time of looking at the application. And we're also, if you had a proposed proprietary name for review, what you do not have to have, but if you do, we're making sure that that was also coded separately, because that goes to another office for them to make that decision if we will be conditionally accepting that proprietary name that you sent for review. Then, as a project manager, we are conducting a physician labeling rule format review of the prescribing information. Again, this is only for format and not for content. And we are doing that by day 60. We have to look at that to make sure the formatting is not, really off. And then we're also beginning our own project manager file and review. We have things that we're looking for. Like I said, certain forms, that debarment certification that Swati spoke about. Different forms, we're looking at all kinds of things. We're looking at just a lot of little administrative things. We're looking at, do you have the patent certification? And if you, like I said, do not have any relevant patents, then you're saying you have no relevant patents. You're checking that on that form. But there's all kinds of things that we also have to look for before we get to that 60-day filing period, so that we can say, from our perspective, this is a fileable application. So during this time, we're also, when we receive that application, we are blasting this out to our respective division, centers if we have to. If it's a drug device combination product, we will send it to CDRH to let them know, hey, this NDA is here. This is what the drug is. This is what the indication is. This is when we receive the application. We're sending it out to everyone with a little message. Please assign reviewers, okay? And everybody knows by this time internally that we're sending this out to get those reviewers assigned as quickly as possible so that we can get our internal meetings on the books. To start, we need to get that filing meeting on the book. And we're also confirming signatory authority. These top two items, confirming the signatory authority and confirming the cross-discipline team leader, we'll do that before we even get to the filing meeting, just because they need to make their own little determinations. We need to know if this is going to be an office level or a division level signature. This also plays into who we invite to that meeting, who we need to actually make sure that their schedule is free when we're inviting folks to our filing meeting and any other milestone meetings that we have that we'll talk about going forward. And then we're also confirming our cross-discipline team leader. And we're requesting reviewers, as I said, from appropriate team leaders. So 3 major tasks to accomplish by day 60 are determining the fileability of your application, which we do with a filing meeting, which we'll talk about in a future slide. And we're also making sure that that is documented within DARTS and Panorama, because we need to make sure that if this is fileable or if we're refusing to file that application, that we have our justifications documented before we're communicating anything to you. And we're planning our review activities by day 60, which again we'll talk about in future slides. And we're communicating our decision to you, the applicant, as applicable. By day 60, we have to communicate to you. It may not be in writing, but we will definitely pick up a phone and say, okay, this was filed, and we'll let you know that you'll be receiving your 74-day letter at a later date. It doesn't have to be by day 74, but just if we're trying to just get a couple more things together internally. Okay, so for our priority and standard review designation, so the filing meeting is scheduled based on the tentative decision of the review timeline. And I say tentative because this was going back to the last slide. That's why we're trying to get that cross-discipline team leader assigned as soon as possible, because we're talking to them before we even get to the filing meeting about, okay, with the little bit of time you've had this application in your hands, are we feeling like this is, do we get a sense this is a priority or a standard review? I know a lot of times you all will submit and say, this is my priority application, but we actually make that determination internally, whether it is priority or a standard review. So if it's a priority review, we have to have that filing meeting by day 30. If it's a standard review, we have to have that filing meeting by day 45. So now that you know this, here's the peek behind the curtain. It doesn't always happen on day 30. It doesn't always happen on day 45. That's a very tight little window right there. What I will say is that it may happen on day 31. Still not bad, right? It's not bad. Shake your heads. That's not bad, right? Okay. And it may happen on day 46, just because that's a very tight window to try to get all these people in the same room. You know, day 30 is typically like a type A type of a meeting, and it's just really tight, especially if it's around like conferences or anything like that. But we will get it on there. What we also will not do is we will not play it too close to that day 60. You know, it may be day 32 or day 47, but we will not play it too close to that day 60, because we know that we have to make a decision and let you know something by day 60. Okay, so for priority review for applications not in the program, that timeline is 6 months from the receipt date. And for standard review, it is 10 months from the receipt date. And so we're scheduling our initial milestone meetings. We may or may not schedule out all of the milestone meetings at the very beginning when we're scheduling our filing meeting. We do this because, again, people's conference schedules, holidays, federal holidays, you got to take off. We want people to start planning for this in their lives as soon as possible so that they can say, okay, I'm not going to plan a vacation around this date because I know I have this. Or if they're going to plan the vacation, they plan for coverage. So we want to let them know as soon as possible. And what happens if we refuse to file the application and you do not file over protest, because you can file over protest and say that you don't think it should have been refused to file, then if you're not doing those things and it was refused to file, we just delete those meetings off the calendar. It's just that simple. So here's a nice chart for items in the program and differences between items in the program and not in the program. I'm not going to go over all of this because I feel like a chart, when you see it, it kind of pinpoints a lot on its own. But what I will talk about is in the very top tier on the left, it says 6 to 10 month clock begins at 60-day filing date, and that's for applications in the program. Now, that is total, that is 8 months and a year because you've had your 60 days. Now, what I do want to point out to you, because this will come up later on, so pay attention. What I do want to point out to you is that does not change our review timeline. Okay, that additional 2 months, as I think Callie spoke about previously, is really for trying to resolve any of those issues that come up, during the late cycle, late in the review cycle. Things like inspectional issues, the risk management, and any deficiencies with that, any advisory committee advice, and application deficiencies. It's to kind of resolve matters like that. It is not giving reviewers internally, our primary and secondary reviewers, additional time to review the application as a whole. They get the same amount of time to review the application as they would with an application that is not in the program. Another thing I want to point out to you is on the right-hand side, the third portion that starts with refuse. Refuse to file and standard priority review criteria do not change. Whether you're in the program or not in the program, we are still looking for a fully English translated application. Now, you can submit your Japanese, you can submit all of your other translated, applications to us, but we are still looking for a fully English translated application for our purposes. We will not be dedicating our resources to translating your application. And also to say a little bit more about that refuse to file, because I know that's a scary term for everybody. Okay, we have the criteria for the refuse to file. And in another link, I give you in another link on another slide, I give you an actual guidance for that. Refuse to file, there is wiggle room, because a lot of times, you want to get the application into us. We're going to call you up for this information. If we see something, a full Japanese translated application, we're going to give you a chance to say, I'm so sorry, I forgot I have the English translated right here. Let me send that in. Okay, we're not going to say refuse to file if you have it sitting right there. Okay, we're going to talk to you. Okay, again, we want to be your ally. So these are not just like, okay, the criteria out there, if we see it, forget about it, we want to be done with it. No, we're your allies. We're going to give you a chance to come back from the mistake that you made, because we're all human. And then, obviously for the applications in the program, we have 2 additional meetings, the mid-cycle communication and the late-cycle meeting, including the FDA meeting package. So that's just some things that I wanted to point out to you, because, again, this will come up in a later slide. So by day 45, these are some of the obligations that we have. We have to hold that filing meeting to make a filing decision. We hold it by day 45 for the standard review. We hold it by day 30 for the priority review, as previously mentioned. The filing meeting has 3 main purposes. We're confirming the final review classification. Remember I said, now we make a preliminary decision before we even get to this filing meeting, if it's standard or if it's priority. Now we can get to this meeting, we confirm, okay, we're still thinking this is priority, right? Now they'll confirm and say, yes, it's still priority. Final answer, okay, if you ever seen Who Wants to Be a Millionaire. Final answer, okay? So, and then we're identifying any significant review issues to communicate to the applicant. And review issues are review issues, filing issues are filing issues. So that's not to say you will not get filed. There's a clear distinction, but we will communicate those to you at that time if we have it, if we need more information. And we're determining the fileability of the application. We literally go around the room to each respective reviewer and we say, okay, pharmacology, toxicology, is this application fileable? And they'll tell us, and they'll give us their justification. If it is refused to file, again, they'll tell us this is not fileable, and these are the reasons why. And sometimes, not sometimes, if someone disagrees within that room, they'll say, well, I don't think that's a filing issue. I think that's a review issue. I think it can still be filed. And we'll have back and forth about it, and that's fine, because at the FDA we have equal voice. So everyone's allowed to speak up, okay? and we listen to one another. So the filing decision is based on the filing reviews, and then the two choices that come out of that meeting are if the application can be filed or if it is refused to file. And there's a link I was talking about earlier that gives you just kind of the criteria that we would not file an application for. So, milestone meetings for non-NME applications. So, in the regs, filing and planning meeting are by day 45. Typically, and that's for a standard review, but typically what I want to tell you happens, at least in my practice in my division, I've talked to some other project managers, clearly not all of them. However, we can combine those meetings, which is usually what we do because, again, it is very hard to find 2 hours to talk, 2 separate hours to talk on one calendar for respective reviewers within that day 45. So we typically combine those meetings, and that's fine. There's no right or wrong way to do it. People can do 2 separate meetings, good for them if they can find 2 hours within 45 days. But if they cannot, we just combine them, and it's not a big deal. And then you have your mid-cycle by month 5 for standard reviews and by month 3 for priority review. I won't read the last one just because you can see it for yourself, but what I do want to read is that little point at the bottom. The review team may decide to hold additional meetings as needed depending on the complexity of the review. I want to drive home that if we do have a deficiency or something that we need to request or something that we need to talk about, we are not waiting until we get to month 5. That is the wrong thing to do. We will send an email. We will call each other. Sometimes we'll meet up in the hallway. If somebody needs another meeting on the calendar, we get that other meeting on the calendar. Even though it's tough, we find a way. Even if we have to sit in the meeting where everybody knows they're going to be at and just wait for that one to complete itself and come in on the back end of it, we'll do that. But we are absolutely not waiting until month 5 if we see something at month 3. So I want to let you all know that, because sometimes we get these calls, well, I know the mid-cycle is coming up, and I'm educating, as I'm talking on the phone. Well, just so you know, we don't wait until month 5, We're constantly talking about these applications internally. So that's just another point that I want to drive home. So this is a chart for applications in the program milestone meetings that we have. So there you see mentioned the mid-cycle communication with the applicant, which is special just for the applications within the program. That is usually scheduled within 14 days of the internal mid-cycle meeting. Again, we're calling you up as the applicant, and we're going to make sure that you're available during that date. Again, if this happens, if it happens within day 13, of our internal meeting, then we'll get it on the books earlier. But again, if it happens by day 15 because maybe you were not available, again, it's not super huge, but we try to stay close and tight to that day 14 because we know you want to hear something. And then we have the late cycle meeting, which again is pertinent to the applications in the program. So if you have an advisor committee, which again I want to let you know, you will not always have an advisor committee just because it is an application in the program. And sometimes we have advisor committees for applications not in the program as well. But I'm just letting you know, you will not always have an advisor committee. If you do, then we will schedule that late cycle meeting 12 days before the advisory committee, or by month 9 if there is no advisory committee for a standard review. And you can see the timelines for the applications that are priority review in the program. So internally, when we have our own mid-cycle communication, we're planning. The way a lot of our meetings go, that we always have an agenda, and we really try to stick to that. So during this meeting, we're planning our agenda that we're going to be discussing with you. We go from everything from what we're going to discuss with you, the issues and deficiencies that have come up, any additional information requests potentially needed, any outstanding information requests that we want to mention. We're going over proposed dates. By this time, us, the project manager, we should have looked at the calendar to say, okay, I have this date and I have this date. This person over here has, something on their calendar that's blocked out. Are you going to be able to make it to this meeting, or should I move it over to this other date? Because when we get to that, mid-cycle meeting, we want to talk about the late cycle meeting, already talking about the scheduling of that in the future. If there's any post-marketing requirements, commitments, and risk evaluation and mitigation strategy issues, we're going to bring those up at the mid-cycle discussion with you. And again, we're even discussing who's going to convey this information in the meeting. A lot of times it's a cross-discipline team leader, but let's say they don't, talk or can't talk, or they're going to be out. We're saying who's going to cover them in this meeting. We really plan it all out, and so that we can make efficient use of our time. And as you can see, if there is an advisory committee, we're going to update you on that where applicable. And then again, who will participate in the mid-cycle communication meeting? Who's going to be actually available? Again, if people have, conflicting things in their schedule, they may say, well, I don't really have anything to really offer for this particular meeting. Can I be excused and go to this other meeting? We'll say yes. But another thing that you should know, a little peek behind the curtain, if anything comes up in that meeting, any other meeting that you have with the FDA for a reviewer that is not in that meeting, we will relay that message to that reviewer. We're not going to keep it a secret. We're not going to say, oh, well, they should have been here. We're absolutely going to convey that message to them after the meeting, and we'll get a response back to you. So during the actual mid-cycle communication with the applicant, which is usually led by the cross-discipline team leader, me as a project manager, I've coordinated the scheduling of this, and I'm the one who's taking the meeting minutes that will be conveyed to you within 30 days of this particular meeting. And so again, we're going down all of the agenda items that we covered in the previous slide, any significant review issues, any major safety concerns, everything that we talked about previously we're covering. So I'm not going to go back over that list again. And then this fulfills the mid-cycle communication milestone for applications in the program. And again, those meeting minutes, those will get to you within 30 days. So now we're at the late cycle for applications in the program, and we're holding our internal meeting for that as well. We're planning, our pre-meeting background package that we'll issue to you no later than 10 calendar days or 2 calendar days for expedited review prior to the late cycle meeting that we scheduled back when we had the mid-cycle communication with you all. And so we'll send you that late cycle background package, and we'll have the meeting, and those minutes will also get issued to you 30 days within that meeting as well. So now we're at the wrap-up phase, and we're discussing the approvability of the application and addressing any outstanding critical issues that have been resolved, that have not been resolved. We have an agenda for this meeting as well, and the agenda includes discussions regarding any risk management or labeling issues, post-marketing commitments, and the need for center-level involvement. Sometimes we get to this and we may need additional advice, and we will reach out to the center. Now I can tell you, if our calendars are crowded, you should see the center level's calendar. But what I will tell you is I've had to do this one time with an NDA where we needed the center level input. We're still working on getting a decision made timely within the goal date that was set. So we'll get that meeting on the calendar quickly, even if we're at work at 6 p.m., 7 p.m. We'll allow folks to call in if they need to, but we're getting that. That's a very quick turnaround for that meeting. And at the meeting, a plan for resolution of issues is discussed, and a preliminary decision is discussed about what should be made going forward. If we're going to approve it, CR the application, or if it's going to be a tentative approval, which we'll talk about going forward. Also in the wrap-up meeting, if indicated, a REMS notification letter will be sent, which is usually handled by the safety project manager, but not always. And then we'll begin the REMS discussion with you, the applicant, which again is usually handled by the safety project manager. And all of these timelines are the same timelines that were mentioned for like sending the labeling, the PMR, the PMCs. The timeline that was put on your 74-day letter to begin those discussions, that's when we'll begin those discussions. So labeling, PMR, PMC discussions with the applicant begin. And then we call you to actually make sure that you're available to discuss the labeling with us. Before that meeting, you'll have our proposed labeling in front of you so that you know exactly what we're going to be talking about. And I say substantially complete labeling will be conveyed to you because that's a term that we use internally to say that all reviewers have looked at it, our respective divisions that we also reach out to, our Office of Promotion, they have to take their special look at it, and as well as the MEPA. And so we're communicating that labeling to you, and that will, convey, where we're at so far. And again, when you come to the table, when we have that TCON with you to discuss the labeling, tell us what you think. If you have a disagreement with something that we have proposed, let us know, and we'll talk about it, and we'll go back and forth, and that's fine. Okay, so taking an action, the team works to resolve any remaining issues such as labeling, PMCs, PMRs, and REMS, and then a letter is finalized based on the regulatory action. And I just want to drive home a point that Swati made about exclusivity determination, because we get this a lot. The exclusivity determination is made once an approval action only is given, and so we get this big distribution list that we send out any action that we're taking on an application. But as it pertains to exclusivity, once the approval letter is drafted and sent out, it's sent to the exclusivity board. They're on the distribution list, and they are the ones that make that determination. So when you call us and say, well, do you know when the exclusivity determination will be made, we can only refer you to the exclusivity folks, because and even they may not have a definitive timeline, but they're working on it. They're actively working on it. They absolutely know that your application has been approved, and they are working on it. But that is not within our jurisdiction. That is not something that the division actually has a say-so in. So once we take that approval action, once we say that the decision is to approve the application, the project managers usually are the first ones to draft the approval letter, and we circulate it to all of the review team and the signatory authority, because when it's actually time to sign a letter is not the day for the signatory authority to see it. They need some time to review what they will be signing and justifying when people come and ask them, oh, why did you approve this? And then all reviews, again, must be finalized and signed off in our internal electronic archive before the action letter is signed and issued. Once an approval action is taken, we confirm receipt with you, the applicant, that you receive the courtesy copy that we try to send you through email or fax, and then we're immediately notifying the FDA press office and the Office of Communication if an FDA communication was prepared. So that's just to say we are not always preparing a press release. Every application does not warrant that, but if we did, then we will be talking to the press office right after. If we take a complete response action, then again, I'm drafting, a project manager is drafting a complete response letter, and it absolutely will include the deficiencies found by the review team and any recommendations for corrective action. And again, we're sending this around to everyone, and we will, if there was a need for the REMS, we will include that into the CR letter. However, we may or may not include labeling in the complete response letter. And once you receive that complete response letter, I do not have it on here, but you do absolutely have the right to request a Type A meeting. And a Type A meeting just means that now you have stalled product development, and you need a calendar on the books within 30 days. You absolutely need to hear about this as soon as you can, so that you can get out of this status. And so you resubmit your application, after you talk to us. If you want to, you may feel that our deficiencies were very, clear, and you agree with them. But anyways, when you're ready to resubmit, you resubmit your application, and we'll say if it's Class 1 or Class 2 resubmission, which means that it will take anywhere from 2 to 6 months to review that application respectively. If we are taking a tentative approval action, this usually comes up basically because of overlapping exclusivity, and if one company already has marketing exclusivity on their application, they've already been approved, we cannot approve that application. And so we'll send you a tentative approval letter, which sounds exciting, but it's really not. It's it's not a grant. You know, you're not being granted approval with this letter. We're saying that, you know, as we see it, it looks good, but we could not do it because we had this overlapping exclusivity. So you will still have to, you know, resubmit an amendment. And another, you know, peek behind the curtain. We will not be updating you on when that other exclusivity expires. You will have to keep track of that yourself. And also, do not send that amendment to us like the day you want it approved. It's just not going to happen. We don't have the resources. Submit it to us 2 to 6 months before you think that exclusivity is about to be expired, so that we have time to actually approve it. And, you know, so there's no lag. Bless you. And then we have a CFR reference for the tentative approval, because this really does not come up too much. Here it comes up more in generics. I've seen it once, and then even the one time I saw it, I think it was probably the first time we had ever seen it in my division, because it just doesn't come up too much, but it comes up more in generics. So for all outcomes, whether it be a complete response, an approval, a tentative approval, after that letter is signed, I send you the courtesy copy, and I'm rushing a little bit now because we got 2 minutes and 29 seconds. Okay, and so the official letter comes to you in the snail mail, and I just want to say that we will give you a call even after we email you or fax you, because we want to make sure there was no breakdown of technology, and we know that you're waiting for these actions. And then the review clock stops. Here's a challenge question. What are the differences between applications in the program or non-program applications? Choose all that apply. So your choices are review timelines, refuse to file criteria, mid-cycle communication, labeling discussions, and late-cycle meeting, including FDA meeting package. Okay, I'll give you a little time to digest that. 2 seconds, because I'm at 1 minute and 48 seconds. Okay, so who said review timelines A? Raise your hand. Oh, yay! Oh, well, okay. Well, still, I'll say yay for you because you were brave. Because that was a trick question. That was a trick question. As I said, it does not, in applications in the program, it does not change the actual review timelines for the primary and secondary reviewer. What it does do, it adds on an additional 2 months so that we can try to resolve some of the issues that come up during the last part of the review, which are inspectional issues, application deficiencies, anything like that. It gives us another 2 months. And then also, so the actual answer is C and E. Those are the differences. Because remember I said the refuse to file criteria, you know, do not change. And then we still have the labeling discussions during the same time. All right, so we have 57 seconds. I will be here at 4 o'clock. If somebody can get off a question, I'll try to answer it. I'm sorry.
All right, I'm not going to let you off entirely because we have 40 seconds. Ray, give me one online question. Sorry, online folks. CDER SBIA at fda.hhs.gov. That's where to submit the questions that you really want answered, which we didn't have time for. Go!
When do we file the proposed proprietary name information? Is it prior to NDA submission?
Well, in the pre-submission phase, people submit a proprietary name review, but when you actually submit the application, you have to submit that proprietary name for review again. I hope that answered the question.
It did, because we've got 3 seconds left.
And they're online, so they can't say I'm wrong.
Yeah, exactly. That's the best part of online questions. All right, and Lois will be here at the end of the day to answer any of those questions you have. Please help me thank her for coming and giving such